You're about to hear something all new to the world of aesthetic medicine. Five of the country's most credentialed surgeons, each at the top of their specialty, having the honest conversations that shape exceptional results. This is where surgical expertise meets collaborative excellence. This is Aesthetic Authority.
Well, Alex, a big part of our practice that people don't even realize is hair restoration.
Correct. Yeah, it's kind of hidden. I feel like even in our organization, sometimes it gets like our organization is so big and it's this like piece that's actually very busy and kind of churning all the time, but it sometimes doesn't get our full attention.
Yeah, and I think that's how people view it just at large when you think of aesthetics. You know, I think we think of, oh, yeah, we're going to do a breastwork or we're going to do this. And I think that being in this world has really made me realize how it affects people.
Oh yeah, big time. I think this more than anything else, like a lot of our focus is on aging face things, doing facelifts, brow lifts, that type of thing. This definitely affects people very differently.
Deeply.
Yeah, very deeply.
Deeply. Yeah.
And it's maybe a little bit different for men and women, but on the male side of things, and I mean, I've dealt with my own hair loss, so I can kind of speak a little bit to this personally, but it affects you at such a young age too. And that's a little bit different than your standard maybe 60-year-old female that doesn't like her jawline. But this can affect males at 25 years old. And so they're sort of maybe starting out their career or they're still in school maybe. And so it's like it can be a huge confidence detractor. And I think that's why it affects people so deeply.
Yeah, I think a significant portion of my hair practice also includes women. I know yours too. And I always talk to them because they come in with such a heavy mindset that you can see it when you walk in. And I think what it comes down to is, not that it doesn't affect men, but I think it is socially acceptable to be a man that has thinning or
Absolutely.
have a bald head.
Yep.
A woman with that feels a totally different pressure, I think.
Yes.
And so it has been like a great joy to be able to help people in this. Unfortunately, it's progressive. I don't have a silver bullet. I always tell patients, but I am like super excited about all the amazing things that are on the way.
Yeah.
It's very easy because hair loss is so ubiquitous that people try everything.
That's right.
Yeah.
Yeah. People try everything. And there's a lot of stuff out there that probably doesn't work. But I tell patients that a lot of stuff does work. I mean, the reality is, I think most of the stuff that we use doesn't necessarily have mountains of double-blinded, placebo-controlled trials like some other big pharma type medications do. But a few of them do, and then a lot of them have more anecdotal things behind them. But it's still data that's supportive, and I think most of the stuff out there does work a little bit, and that's sort of the problem. It's also the beauty of it. But what I find in my practice is that the people that kind of do the most like get the best result.
Yeah,
They're tackling things a little bit with medications, with random topicals, with random vitamins, and then at the right time maybe a transplant. Those are the people that kind of look the best the longest. But it is tough because there's so many different things. There's so many different kits you can buy. There's so many different vitamin supplements you can buy.
There's a lot of overlap between them.
Totally.
I think my problem is patients will say, I took this one vitamin and my hair is still falling out.
Yeah.
And so I think there is an expectation that this one thing will help. And I try to explain to patients, this is kind of a complex multifactorial
Right.
etiology usually. And so sometimes we have to tackle that with multiple approaches. I
Right.
do agree with you that that seems to yield the greatest success for my patients.
Oh, for sure. And I think I try to get patients a little bit out of their own way in a sense with respect to thinking about these different modalities because I do see a lot of like kind of linear black and white thinking.
Yeah.
Like, okay, so I should take biotin. And you're like, well, sure, yes, that will help, but there's all these other things that you need to do as well. Like there's not, as you said, there's not a silver bullet. There's not one thing that's going to just revolutionize your hair loss.
Yeah, I think that's the nice thing about what we do because, like, let's say biotin, it's a very important, vitamin. But the
Right.
problem is most people that we encounter in our practice are not so biotin deficient that they are going to have like a complete reversal of their hair loss. So that's why I try to explain to patients too. The other thing too is a lot of people have tried, I think, really pretty good over-the-counter medications like minoxidil. I try to break up the thinking though, because there are things that discourage patients about taking this, and it's really about reframing how are we going to tackle this in a way
Right.
that works for you, whether
Right.
that's a different type of medication, whether it's a different way to get it to you to change your compliance,
Right.
whether that's adding other therapies that are going to give a bigger impact. I think
Oh,
that
yeah.
all comes together.
Definitely. And also I feel like I have this conversation every day with patients because they're looking for an answer, right? They're looking for like, okay,
Fix it.
fix it. What is the
Fix
thing?
it.
I came to you, you're the doctor, you tell me what pill to take. And I tell them all the time, I'm like, look, there's several different pills I could give you, different topicals, ointments, creams. I had a patient putting egg yolks in their hair once. I mean, there's a million
Was it
different
my
things.
mother? Yeah.
Yeah, right. There's a million different things you can do, but at the end of the day, we have to come up with something that you're going to actually do.
Mhm.
Because I mean, compliance is everything.
Yeah.
And as you said at the beginning of this, is hair loss is progressive. There's nothing that you take and fixes it. It's a biological battle, essentially for the rest of your life. So what are you going to do?
Mhm.
If that's a pill every morning, okay, let's take a 2.5 milligrams of minoxidil every day because you can do that and be consistent with it.
Yeah.
If you can't do that, then like let's not talk about taking pills. If you hate pills and you're not going to do it,
Mhm.
then it's pointless for me to prescribe that for you.
Yeah, we'll always steer you with what has the highest evidence base. So that is a little bit tricky, when I explain like how I come up with the things that I think will have the greatest impact based on kind of what. Now, we do have some additional things that I think have been beneficial to tailor that to patients. That's one of our tricho tests where we actually take a little swab of the buccal or cheek mucosa. And I think that's been great because we're able to kind of determine what you as a patient seem to respond best to.
Yes.
And I think that has helped me tailor things to patients and hopefully get them on a path where they see results quicker.
Yes, absolutely. I like the trigo test. The thing I talk about with patients though is that it's a genetic test. And it's really, really cool. Like when you see the data that we get from these tests, like it's really fascinating stuff. What it is not is an actual
Diagnosis of your
diagnosis of the genetic cause of your hair loss. As you said at the beginning, I mean, hair loss is so multifactorial. There's almost never like one specific diagnosis. So what this test is doing, to your point, is it's looking at sort of all these different medication pathways and figuring out, okay, given your exact sort of enzyme milieu, what are you going to respond best to? Which medication cocktail is going to suit you best?
Yeah.
Which I think is really, really cool. But there's also, there's other things for people that, again, that maybe aren't up for taking a pill every day, or they're not going to use something topical in their hair every day because it feels greasy or whatever.
Mhm.
And so that's things like PRP, which is not for everyone, but it is something that requires a little bit less compliance as far as that goes. 'Cause
You just got to come show up to the office.
yeah, if you can show up 4 times a year,
Yeah.
and then progressively, I actually, initially we do a 4 times per year sort of treatment plan, but then into perpetuity, I'm doing like maybe once, twice a year.
Yeah, I tailor it to what the therapies that the patient is doing, their kind of trajectory. You really do get to know patients and like
yeah.
kind of what is normal, what their shedding is like, what I expect their density to look like. So I agree with you.
Yeah.
It's tailored. There's not a perfect science. There's again no literature, but we do have a pretty vast experience with patients who have undergone this treatment. We have used different PRP sort of platforms. So that is able to make a really big difference on what you're getting. Sometimes you're just taking a little bit of blood spin and getting that plasma, but we are taking a larger amount and concentrating that. And I think that made a big difference, Alex. It makes a huge difference. So sometimes it's PRP is PRP, but it's kind of apples and oranges because of the level of a kind of intensity and the concentration that you're getting. So
Yes.
something to kind of inform patients about.
I totally agree. I think our PRP results have gotten just better and better over the years. And you're right too. Like it's interesting, especially for our long-term patients that have come to see us for years and years, and maybe they've had a transplant or maybe they haven't. But with respect to PRP, it's kind of fun. Like for my long-term PRP patients, they are so dialed in to like knowing their exact cadence. They're like, I know every 4 months I come in here, and if I don't, then immediately I start seeing shedding, I start seeing thinning. But as long as I keep up with it, like that, my hair feels healthy and strong. And it's kind of cool because the longer that sort of doctor-patient relationship goes, the more dialed in they are.
Yeah.
Because a lot of times when patients come in and you start asking them about their hair loss, they don't really know. They haven't really paid that close of attention to
They
it.
just know it's thinner.
There's like, I don't know, it's thinner. I don't really know when it started. I know it doesn't look great in pictures. And then the longer we go over the years, it's like they get really tuned into it. So it's kind of fun.
Yeah, I think so too. It's great seeing people who have gone through this process and they're, I don't know, like getting married and they look and feel their hair is better than it was 3 years ago. I mean, who can say your hair is better when they have hair loss? So I think that in itself is an amazing thing.
Oh yeah.
Yeah.
It's really fun.
So one of the great things I think about is we have a pretty comprehensive team in terms of our dedicated staff that is just lives and breathes hair restoration. One of those people is our one of our nurse practitioners, Stacy, but also she's a trichologist. And
Right.
so I think that's really important. We are not just looking at you as, hey, you got hair loss, I can do this procedure and
Right.
we can it really is about kind of getting down to the level of follicle.
Mm-hmm.
You know?
Yeah, absolutely. I mean, the trichology stuff is really, really interesting. I mean, there's just so much science behind hair and hair loss, and it's not a simple thing. At the very beginning of this, we talked about how multifactorial hair loss is, and frankly, how complicated the hair follicle is. It's not a hair is not just like a strand of like random fiber. I mean, it's a billion different cells, different cell types, with its own blood supply, its own metabolism. And so Stacy really has like a really incredible level of expertise there. And she's just so talented, too. But it's great to have her, sort of guiding the ship, I think,
Yeah,
because
and partnering with us.
yeah, exactly. Because she can think. She's not only just really talented, like with from a procedural standpoint, but she is able to kind of think more comprehensively about a patient's hair loss. Because the reality is, um, hair loss, the answer to hair loss is almost never one thing. So we can do a transplant, yes, but does that mean that you can then sidestep and forget about all the other like medications, topicals, all those other things? No, like you should be doing those things too, likely. And so being able to kind of look at this from a more comprehensive standpoint, I think has elevated our results like tremendously.
Yeah. You mentioned young patients. So you have a young, I don't know, 23-year-old gentleman. He's got 4 years of hair loss. Let's say he's like pushing Norwood 3 to 4. I mean, like
Mhm.
he's just pretty advanced. Like what is how do you take this patient and help this patient?
Yeah, it's a tough situation, and we see it, pretty much every week. The standard in our industry has been sort of a cutoff at age 25. So below age 25, we push sort of the more medical therapies, and then over 25 is when we can maybe start talking about hair transplant. It's a delicate conversation, to be honest, Heather. I mean, to have with patients, and it's not as if there's some magical biological tick that goes off at age 25, like a hair transplant magically starts working at age 25. Obviously, that's not the case. But the sort of nuanced reason behind that, as you know, but some of our listeners may not, is that when you're really, really young and you're first experiencing that temporal loss, it would be easy to take some hairs from back here and pile them in there and make it look thicker. But what you're not doing is sort of seeing the future
Yeah.
and seeing that, well, this patient's 23 now and they're already progressing. So it's very likely it's going to progress fast. And you're going to pile a bunch of hair up front and then they're going to lose it behind that.
Mm.
And you will have then depleted their donor site.
Or used it like not as effectively. I think.
Exactly. Yeah.
That
Yeah.
is what I think it is.
Yeah, I mean, I guess that's a better way of putting
Yeah.
it. It's still there. It's just you've kind of used it. You've been a bad steward of their donor site, and so now they might have just sort of another aesthetic problem. Interestingly enough, I have a patient that came to me with this sort of exact scenario. He was some temporal progression. but he was young. I think he was 23 or maybe he was 24. And I really just felt like this is not the right time. We need to give this a little bit of time. I coached him on some medical therapies. He really wasn't interested. He really was dead set on getting a transplant. And this might lead into a different discussion. I know we wanted to talk about Turkey at some point during this discussion, but he actually ended up going to Turkey
Huh.
and had a transplant. And to be honest, it looked very good. Like he came back in and saw me afterwards. And I told him I didn't think that was a great idea, but he did it and it looked really good. And literally a year later, it looked terrible, like really bad. And so now he's kind of seeking some other therapies,
Well, that's too bad.
yeah, that we have to offer. And I think, we'll get him in a better place, I think. But it was just literally the quintessential perfect example of why exercising prudence and
Yeah.
and just good clinical judgment is really, really critical when you're counseling these
It's
patients.
really hard because you want a solution. There's things that look good. You see it all over social media. That's to say there are amazing hair practitioners and like docs all over the world. And I
Yeah.
respect so many people that are in the Middle East and Turkey. But I think that the one thing that patients will tell me and when I learn from their experience like this is, the commitment is not to do a procedure. The commitment is to understand you and your hair loss and take care of you now, but also make sure that you look and feel your best 10, 20, 30 years from now. That is how
Absolutely.
Dr. Quitella has always looked at our patients. That's how he's always looked at hair patients. That is why he has patients who have been with him for decades.
Yes.
And that is something that I think is so important.
Absolutely.
Yeah, in this aesthetic practice, I thought when I was choosing which way I wanted to go as an otolaryngologist, I wanted to kind of have that patient relationship and be able to maintain that. And I think on aesthetics, I kind of thought, hey, you do something, you're done. And I just find that to be
Yeah.
so far from the truth. And it's been such an unexpected pleasure, I think, from
Yes.
a professional standpoint for me.
I totally agree. And I similarly didn't like really see that coming
I know, it's
necessarily.
crazy, isn't it?
I guess
They like you.
yeah, they like you. And yeah, and I like them too. It's like it's such a nice relationship and especially once you gain someone's trust and they understand that you genuinely are sort of looking out for their best interest, not just today, but 20, 30 years from now. And that's actually something I say to pretty much all of my hair transplant patients.
Yeah.
I say, look, moving a hair is not that technically difficult, but what is difficult is being a good steward of your donor site and making sure that I think the phrase I use with a lot of my patients in consultation is that it's my job to sort of see the future, like 20, 30 years from now, what this is going to look like, so that what we do now serves you well in the future.
Yeah.
But back to the age thing a little
Yeah.
bit, that 25 cutoff I find to be interesting. I mean, I have very few, but I do have some patients. One I saw recently where he's younger than 25. I think he's 22 to 23, but his hair loss is so progressive that I think we are going to do a transplant on him because there's no seeing the future. The future is here.
Futures now.
The future is now
Futures
on
now.
him.
Okay,
And
got
so there's really no unknowns ahead of us. Like it just is sort of what it is. And so he's someone that we're going to transplant sometime soon to get him in a better place. So again, that's the industry standard, but it's not sort of
Case by
magical.
case,
It's
right?
case by
Case
case.
by case.
Exactly.
Yeah.
Exactly.
So let's say we are proceeding with a transplantation. Can you take us through like what are your patients asking for? So there's a lot of different and there's newer technical things that are evolving with hair transplantation. We classically think about FUT or follicular unit transplantation. That's where we remove a strip of scalp in the back. We are individually dividing that scalp into individual hair follicles. And then there is also the FUE, which I always say is like kind of randomly cherry picking out hair follicles in the back. So
Yeah.
tell me like what are your patients, and then there's so many other derivatives of that which we can get into, but tell me what your patients are asking for.
Yeah, I would say from
How
a
you're judging.
technical perspective, most patients are leaning more towards the FUE technique. It's the sort of newer age technique, and the quote unquote scarless technique. I sort of steer them away from thinking of it as scarless.
It's not.
It's not really scarless,
Yep, it's not.
but
Just scattered scars.
but it's scattered scars you
Yeah.
don't really see.
Yep.
But to your point, the analogy I use with patients is I say, it's kind of like if you're looking at the back of your head like you were in a helicopter flying over a forest. If you randomly remove trees here and there, you're not going to ever notice that any trees were missing, and that's kind of how FUE works. So we're taking individual follicles, sort of coring them out, but at random places on the back occipital part of your scalp. And then once the hair grows back in, there's just no way to tell that anybody was ever there.
Okay, I have to clarify because everybody wants to know, does the hair grow back? No, we have removed the follicle. Unfortunately, it would be amazing. I think that's the future when we start talking about stem cells, and we can touch on that a little bit later. But right now, when you remove a hair follicle that you have exhausted, that you are moving that from another place, and another one does not magically sprout up, unfortunately.
Correct.
Yeah.
It's like transplanting a tree.
Yeah.
Another tree doesn't randomly grow.
Yeah.
You've moved it. The
Yeah.
root and everything has been moved. And so that gets right back into why there are even limitations with hair transplant, and why we have to be that kind of predictor of the future and think about your best interest. If everybody had an infinite number of follicles to donate to their scalp, everybody could look like Fabio all the time, no problem. Right? It would just be, it'd make our jobs frankly easy, because every 18-year-old that had a little hair loss, we'd say, all right,
There's no thinking, you
yeah,
know? It's
exactly.
like there's no thinking to it. You're just moving, which,
Right.
you know, maybe one day we'll get there.
One day I think we probably will, but unfortunately right now where we are is there's a finite number of follicles that any individual has to donate, and we have to use those, very carefully.
Yeah, we have to be thoughtful about that. And so there is, I think, a big interest in like, how do we, well, let's focus on this. How do you counsel patients on where we should go with these hairs?
That's a really good question. So I always ask the patients, like, what do you see, and like what's your main goal here? Because obviously I want to work with them to make sure that we're achieving their aesthetic goal. That being said, I do really try to steer the ship in this particular situation,
Using your expertise and your experience. Yeah.
because there's no question that I think tackling frontal hairline temporal areas is more aesthetically important. So if I have a guy, because in this particular situation, it's almost always males, if I have a guy with a really receded hairline, but also a lot of occipital loss, or excuse me, like crown loss,
Yeah.
I will say, hey, let's tackle the frontal hairline first. It's what's going to give you the biggest bang for your buck. It's going to frame your face better. You're going to see that more in the mirror and in pictures, and you're just going to be happier with it. Does that mean we aren't going to then tackle the crown later on? No, we'll do that too, but the priority should be up front.
Yeah. The only time I differ, and you would do the same thing, I know, is like for my female pattern hair loss patients, where you do see a little bit more crown vertex thinning first.
For sure.
I do think I still ask them how they feel about the frontal view, because one of the biggest thing is they'll say it looks really see-through. They've lost some of that density in their frontal tuft, and so being able to reinforce that makes a big difference.
Yes.
So yeah, I think one of the things is I agree with you. There seems to be a shift. I think I've been doing this, about 10 years. And so we were doing, I think I felt like a more 50-50 split between FUT and FUE. I think there definitely has been a shift to FUE. And I don't know if it has to do purely with the flexibility also of styling that people get when they don't have a linear incision. Don't get me wrong. There are some beautiful linear incisions that most of you will never see out there because they've done beautifully. But I think that still my ladies who have longer hair and who want to be discreet about having the procedure, because you're able to keep your hair normal length, just remove that strip, they are still leaning toward FUT. And then most of my men, I think it has seemed to definitely shifted. Yes,
I agree. But to your point, while most of my patients are asking for the FUE, I do prefer FUT for females for that exact reason, because most females have long hair. Most females are not going to tolerate you buzz cutting the back of their head to obtain.
Takes a long time to grow it.
Takes a long time to grow that back. So with the FUT technique, we can basically avoid that. Like, we're just cutting out that strip of scalp, the hair bearing scalp, and then closing it immediately with some really good suturing techniques. And so you walk away that day and nobody's the wiser that anything happened to the back of your
I have some crazy stories. People will be like, oh, I went to work, I just put on the hat, but nobody ever saw anything. And nobody knew I had it. I was
Yeah.
like, wow, that's amazing.
Oh, yeah.
I think people are working from home day 2. I mean, they're just like it really does fit well in a lot of people's lives now, which I
Yeah,
think is
yeah.
helpful.
Okay, Heather. So I want to ask you,
Mhm.
there's for decades in this industry, there's been sort of a stigma of like hair plugs
Yeah.
looking unnatural. What the heck happened there? And so I'm curious your thoughts and what you've seen as far as maybe some unnatural results. Why did they happen? What do you do to fix them?
Yeah. So, with anything we do in aesthetics, it's really about understanding like what is a natural progression of something, you
Right.
know?
Right.
And so the things that I have seen, I'm just going to start in the front,
Yeah.
and that is hairlines.
Mhm.
I think that is one of the most visible things that we see when we
Sure.
look at a person and look at their hair. And I think that there is a nuance that a lot of people don't realize. Well, maybe you do. But when you look closely at a hairline, those first couple rows have those really thin baby single hair follicles. And I think sometimes I've taken care of a lot of patients who have had transplantation elsewhere, coming back, decades later, and I've seen some of these how they've gone a little haywire and
Mhm.
and how to address that. When you put big bulky hairs in the front, it looks almost like the best way I can think about it is like, when you were like playing with Legos as a kid, and you picked up their head and you moved it and it was just like a clear line. I just always that's my visual all the time where it's just like
Yeah.
and it's just too clear, it's too crisp, it's too linear, it's too sharp. Like nobody has sharp angles in their hairline. It may have a little bit of like a 90-degree, but if you look closely, there's a softness to it. There's an
Yes.
irregularity to it. There's a difference in the hair follicles. So this is where I think attention to detail matters, technical things matter, but also like what you as a surgeon sees as
Right.
a natural hairline. And so this is where I tell everybody you have to find somebody where the aesthetics of you and the aesthetics of that surgeon are aligned.
Yes.
Whether it's with hair, whether it's with breast surgery, whether it's tummy tucks, and whether it's facial surgery. So that's my little plug there. You got to find somebody that you have seen their work and you like it.
Yep.
The other thing too is position of hairline. And I have even seen this, not so much with, I have a couple patients who have had hairline lowering surgeries.
Mhm.
And so when that surgeon was making that incision to lower the hairline, it was very, very irregular. Sometimes it's too straight. I had some that looked like Charlie Brown shirt. It was like a zigzag. And don't get me wrong, W-plasty sometimes work very, very well,
Sure.
making those incisions and all over the body, and they blend away beautifully. But I'll tell you, they do not work in the hair.
Yeah.
Yeah, not at the hairline, not when you're taking big um, grafts here that are a little bit too, I think they were a little too far back. It was a little too kind of like enlarged in terms of the caliber of the follicle.
Mhm.
And then they just brought that down. So we fix a lot of these things. Now
Yeah.
you mentioned plugs. I think that's a historical thing.
Sure.
Alex, we used to perform hair transplantation by really taking almost like a biopsy punch. So if those of you who don't know, a biopsy punch is almost like it's a cookie cutter, but it's down to different size millimeters, right? And we use that at dermatologist's office and in procedures where we're trying to remove a little tissue and actually send that off for analysis. Well, when you do that in the scalp, guess what? You're taking an area that has very different density and moving that into a place that has very thin density. And so it's always the mismatch. Now, the beauty of how we have gotten around this and how we have delivered, I think, extraordinary results is taking it down to the level of the follicle.
Absolutely. Yeah, I mean I think that's essentially the difference there is the old plug days were 3, sometimes 4 millimeter swaths of tissue
Yeah.
that would have within that would have, maybe 20 some follicles, and you're moving that all in sort of like a big clump. And so you ended up with literally this kind of clumpy look. Even the textbooks now will say it's like a doll's hair sort of look.
No one likes that.
And I still run into patients that will have. I wanted to bring it up because I still run into patients that'll be like, "Oh yeah, like my uncle had a hair transplant in the '70s, and it looks
Terrible.
terrible." And I'm
Yeah.
like, "Ugh, I know, I'm
Tell me
sorry."
to come, we'll fix it.
Yeah, we'll fix it. Because it's just not like that anymore. I think that when you're doing things with the individual follicle, you just sort of by definition don't get too clumpy. As long as you're also adhering to those other principles that you mentioned. So for the frontal hairline, you want those to be single hair follicles versus maybe a 4-hair follicle. If you get too many hairs in the frontal hairline, then things start to look obvious, and that irregularity is hypercritical. And then even the directionality of the hair.
Yep.
So there's a lot of things that patients don't realize that we're sort of like really dialed into when we're doing the transplant itself. It's not just obtaining the follicle, and it's not just like figuring out the exact placement of that follicle, but in our world, we talk about the angulation of the hair and the directionality of the hair. So which direction is it growing off of the scalp, and at what angle is it growing off of the scalp? All of those things really, really matter as far as obtaining a natural result. So we're kind of always dialed into that. Patients don't necessarily need to like think about that because we're thinking about it during the procedure, but these are the things that are always kind of going on in the back of my head, like during a procedure, and I know they are for you as well.
Yeah, I think the other thing too to talk about is like graft count. People are sometimes super obsessed about graft count. Now, don't get me wrong. The more grafts you place, the bigger the impact. And I agree. I think
Sure.
that's really, really important. But I think part of it is sometimes I can't go too small. I've seen patients who have said, just put a little bit here. And, and I'm like, I want to do this so bad for you. But the problem is I've seen patients who've had that. And what happens is you look like you got like a fence post or a row of trees or a row of hair in the front, and every zit
Right.
behind it looks like a little bit too thin, and it looks very surgical.
Right.
And so you don't see that now. It'll look good for 10 years or so, but as you start losing that hair, patients 20 years later are like, hey, this looks a little weird. I had another patient who had transplantation, but the manner in which it was placed was very calculated. So this patient said that when they were looking and moving, it was almost like when you drive by a row of corn
Oh
and you
gosh.
see that like rows and
Yeah.
it was like highly distracting for people that were looking at
Yeah.
them. And so I think those are things that you never think of. You're like, oh, I got this many grafts. It's like amazing. And it will be amazing. Like you
Mhm.
get the impact of the hair, but these are the nuances that make the difference.
Yeah. Yeah, absolutely. I also think that being really realistic with your expectations, but specifically being realistic with your hairline design. We're talking about hairline design and all the nuances of it. But one of the things just right off the bat, before you even get into angulation and directionality, is just where are you putting that hairline,
know.
right?
How low are we going?
How low are we going to go?
Yeah.
And I think that's really critical. I preach that to all of my patients, is that conservatism is a really good thing with respect to hairline design, because it's going to allow you to have what, in my opinion, is the most natural result, and also be able to utilize those hairs, those follicles that you're distributing or redistributing, use them in the most beneficial way. Because as I tell patients, the lower down you bring your hairline, I mean, if you just give a patient, said, here's a marker, like draw it wherever you want it. Yeah. And they put it mid forehead or whatever. The lower you go, the graft number needed just skyrockets.
Yeah.
I mean, it's sort of an exponential growth. And as we've been sort of saying throughout this entire podcast, we don't have an infinite number of follicles to use. And so keeping that in mind is really, really critical.
I think the other thing too is like, maybe like when you're in your 30s, even 40s, you're really looking for something that looks really youthful, and you would love to have that hairline that you had in your like teens and 20s.
Right.
But truthfully, like think about like as you age, if you have like an older person that has a hairline that of a 19-year-old, you're kind of like, what's going on
Yeah,
there?
it doesn't
So
look quite right.
that's the other thing I always kind of think about too. Like we gotta make sure it looks good and reasonable
Right.
throughout the whole of your life. So
That's right. That's right. Yeah, it's not that kind of speaks to just the nature of, as you said at the beginning, of how we have these sort of long-term relationships with patients. We're not here to be technicians. We're not here to be for you to just say, I want a hair right here. Okay. And we do it. Like, we're here to try to make you look the best for the longest. And that's where I think our sort of perspective, not just clinical expertise, but perspective really comes into play, because as you said, like, patients can get sort of, no pun intended, but they can kind of knock it out of their own head, and they
Yeah.
want their hairline to be this certain specific thing. And yeah, maybe that looks good as a 22-year-old, but it wouldn't really look good as a 72-year-old,
Yeah.
So Heather,
Yes.
if I did a transplant today, what what should I expect as far as the progression, the healing? How does that work?
Okay.
Because
It varies. I mean,
yeah,
let's start with the recipient sites because that will be the same. So if you can imagine a graft is placed, there is a small incision there, and that incision has a little bit of healing that has to go around it. So circumferentially, there's probably a tiny little bit of scabbing. That stays on there for, maybe up to a week, but we really try to minimize the accumulation of that through some of the technical things that we tell patients to do during their healing and recovery process. Um, the back of the head, if it's a linear incision, really is very low maintenance. We typically use a resorbable suture along there. A lot of times we're just checking to make sure that's gone when you come for your early follow-ups. And the area where we FUE or kind of individually extract out those hair follicles have technically a very small area that has a small scab, and that will continue to heal over the course of a week or two. We have you do some antimicrobial sprays. You're washing your hair in some sort of way in about 3 days. You're using regular shampoo at 7 days. In terms of what you're able to do, I mean, some people are kind of like working from home, like I said, and
hmm
within a day or two, you're not necessarily going out and about, depending on the type of transplantation you had and where we're placing it. Um, Usually, most of my FUE patients, when you get about 2 weeks out, your hair's growing in the back, the crusting's really minimized. Hopefully, a lot of this is gone. We're trying to get back in there,
right,
back to life. And so that's really wonderful. I tell patients you got to watch sun exposure for those first little bit. The grafts, they're new, they're healing, and I think if you were to, for example, like sunburn your head, that's a bad thing. But I think normal things are fine. Like I think going out and about, you don't have to wear a hat every time you like leave your home, but
right.
within reason. There was one other thing I think that is kind of important to tell patients, and this is kind of unexpected, is if you are planning to go back out and see people, sometimes at 4 to 5 days, especially doing frontal hairline work, I find that there's a lot of swelling that
Oh
moves in
yeah,
this area. So it is not uncommon for patients to say, hey, 4 or 5 days out, I feel like my upper lids are swelling
yeah,
and they're really swollen. I'm like, I promise this will go. It's usually like really 24, 48 hours that
right.
it's gone. But that's a weird one that
It's very
patients don't,
strange.
patients don't realize.
How long until I see my results, Heather?
Oh, it's
I
like,
want my hair.
I know. So I feel like you gotta you gotta do it and you almost gotta forget about it for a
That's
little bit because if you perseverate every single day, it's a long year.
oh yeah,
The hair cycle is such that it just kind of like it has to get through those cycles and it's 90 to 120 days. And guess what? Not everything hits the starting mark at the same time.
right.
So I think that you start seeing some growth, maybe around 3, 4 months. Now, the problem is some patients also have a little bit of shock loss.
hmm
Don't worry. It's by definition, it is temporary, but I do have patients who have a little bit more of that. And
hmm
so sometimes, like I had a gentleman yesterday, 1 year out, looked great. He's going for his wedding. I'm so excited for him. But he was like, hey, by the way, like a couple months after, I don't think it looked better. I was like, I know it didn't look better
hmm
because just a lot of things were happening. But usually about 3, 4 months, things are starting to be on the up and up. 6 months, I think you're starting to see a reasonable amount of growth. Don't be deterred or don't be upset if at that point things are not to your liking.
hmm
Sometimes, for example, hairlines haven't fully come in. Not
Right,
everything grows symmetrically on one side, on each side. So sometimes patients will say, "This one doesn't seem like," and I'm like, "Just give it a little bit of time,"
right.
and it usually like works out very, very beautifully. But you do have to wait close to a year.
Yeah.
Yeah. So what can we do to speed it along? Okay, I mean, I'm telling patients PRP. PRP, if you're going to do a hair transplantation, PRP, which is platelet-rich plasma injections, that's where we take your blood, spin out those red blood cells, white blood cells, keep the plasma and the platelets, which have these growth factors and are just amazing chemical signaling to stimulate growth. You're doing that throughout the process. You are
Yeah.
doing that to encourage. I'm a gardener. You're going to put fertilizer down and help your plants grow.
Right.
It's a similar premise. I think that the other thing that patients don't realize that it is so beneficial for your native hairs. And so
hmm
if your native hairs, the hairs that are on your head that are not the transplanted ones, that we can see those hairs change from a thin kind of vellus kind of aging hair into those more kind of normal caliber terminal hairs. That is amazing. That regenerative capacity that we're able to have now. So I think there's so many good things about that.
Yeah, I've really liked adding. We sort of packaged in, if you will, PRP to our hair transplants, where we're essentially doing PRP at every hair transplant at the time of the transplant, and then in most cases doing it throughout that first year of
Yeah, so 1 month,
healing.
3 months, 6 months, those sorts of time frames. Yeah.
Yeah, and I think that that's been really, really beneficial. Again, to your point, not only as sort of fertilizer to the new crops you planted, but also to the native hairs that were probably struggling in their own right. And so it's just adding a little boost of life so that kind of all the hairs are getting treated at least to some degree. I think that's been really, really beneficial.
Yeah. I think the other thing too is patients will often say like, what do I do next? I think that's a big one. They're like, I did it. What do we do? And even at that 1 year mark, because I think that they are very encouraged by what we've been able to do, but it is a big investment of the time and the efforts and the finances. So, that's where we really kind of tailor med management. That's when we talk about the schedule. I always tell patients about some of the things that I'm excited that's coming around the bend, hopefully sooner rather than later. And so like, I mean, we always have been talking about stem cells. What is the role of stem cells and how do they play in it? And, we realize they're so critical. If you have a stem cell around a hair follicle that's graying, even though the melanocytes or those pigment making cells have been depleted, you have sometimes an opportunity for those stem cells to come in. And so like sometimes a gray hair doesn't say gray. If you look at a gray hair, sometimes there's bands of gray and pigment and of your natural hair color. I think this idea of stem cell potential is just so alluring
Oh, yeah.
throughout medicine. In aesthetics, the way we think about it is if I could take fat and I could harvest those stem cells and I could get that stem cell to become a hair follicle. And then we can place those hair follicles. Well, guess what? It's amazing. But I was reading in some data or some literature that there's some data from a Japanese group that they have been able to do this. It's all about taking that stem cell, which can differentiate into so many different cell lines to become just this one thing. And I think that is on the horizon, and that will change the industry. That will change so much of medicine if we're able to allow us to grow cells in these manners. But it's terribly exciting.
Yeah.
Yeah. The future is out there. We just have to keep working for it. Probably people much brighter than me figure all that out and be ready for it.
Yeah, I think the stem cell, the regenerative side of medicine is really, there's a lot of really exciting
Future.
things out
Yeah.
there with respect to hair, and I've been reading a lot of those same studies. There's another group in England that's sort of harvested dermal papilla cells and shown that they can sort of migrate into a follicle and help regenerate the health of a follicle that's dying. So there's a lot of like kind of cellular level therapies that are not quite ready to be used, in clinical practice, but they're certainly being researched, and it's really, really exciting stuff. And I think, we've gone from the hair plugs to now these really natural FUT and FUE techniques. I think that is the next big shift
I agree.
in our industry.
Completely.
When those sort of therapies come online for real patient use, like, at the at the level of like the clinical practice, I think that'll change the ballgame for
Yeah,
sure.
I think you're going to start seeing patients that'll harvest stem cells. They'll give it to a company. Those companies will basically sort of start farming out and differentiating those. And you'll say, I will request 3,000 hairs.
Yeah.
And then they'll get shipped to you and your surgeon and they'll be transplanting them in. It's pretty amazing. Okay, Alex, one of the things that I've told everybody since I've like been practicing here that I tell patients I was also skeptical of is the idea of low intensity light therapy. So that's when you have like light caps,
Yep.
flashing red lights
Yep.
that you wear on
Yeah.
your head. Like if somebody said this worked, I would be like, nope, you're ridiculous.
It's
But
ridiculous.
there is data.
Yeah.
There is data, and I think has good clinical evidence. Tell me a
Yeah.
little bit about your thoughts on them.
Yeah, I mean the low level light therapy, red light therapy, long wavelength therapy is really, really exciting in I think all areas of medicine. So there's this, if you look into this, you'll see that it's being used in a lot of regenerative medicine spaces, but we are also using it in hair. So
And I think it has a very long history in here too.
It does.
Yeah,
It
like
does.
a longer history.
Right. I mean, there have been some FDA approved caps around for years and years. We are currently, we've partnered with and are selling one called Revion, which I'm actually using myself. So I've kind of started it Several months ago. I haven't been the best patient with respect to compliance because I forget about it, but it's something you can basically use every day. You just throw it on. It's literally a helmet sort of thing, and then it shines red light onto your scalp. It's very clearly works. It's just another exciting little medical bit, that you can do to support hair growth.
And I always tell that too with my patients, like we were talking about after transplantation, what can you do to prolong your results, or what
Right.
can you do, to keep your hair looking as good as possible, really any stage of progression that you're at. And I think that is a easy thing to do.
Right.
I agree. It's like any expensive face cream that you have. It doesn't work unless you use it. Okay. But I do think it's a very reasonable thing to do. And we have seen it span over. I can't tell you how many people are asking me about red light therapy and red light masks. And so I think there is some good data that suggests it is helpful. And in terms of the hair, we have really tried to even extrapolate to the number of hairs that you can get from this. I think that's always a little bit challenging. Some of those, truthfully, some of those studies have been put out by the makers of the cap, but I think the technology has been very well supported.
Absolutely. And so, we started off this conversation by talking about like how this affects men and women. And I think with hair in particular, and this exists to some degree in the rest of our aesthetic world, but hair in particular, I think it's like this very long progression. You stare at it in the mirror, you look at it in photographs, it's getting worse and worse. You sort of ruminate on it. You maybe buy some biotin or some random Nutrafol or some random vitamin that you've heard of. You take it for a week, it didn't work. You just kind of like rinse and repeat, and then you get to a place where you're like, gosh darn it, I'm like finally at my wit's end. I guess I say all that to say, like, take the confusion out of it. Just come in and have a conversation. There's so much we can, clarity here. Can be really, really beneficial. Doesn't necessarily mean you're like, going down this pathway or that pathway, but just to have a conversation with me or you or Stacy or Dr. Portela, just to know what your options are.
I can't stress that enough. I had a patient who I saw very early in my practice. He came back to see me about 7 years later. We talked about med management. He declined it at that time. And so just to see what 7 years had done,
oh gosh,
it really puts us a little bit behind the 8 ball. Whereas if we had done even med management for 7 years, I think we would have been in a completely different situation. I think some people struggling with the vanity. They say, oh, is it even that important? I think that's a personal question.
Sure,
if it is something that is important to you, that, like you said, that starts affecting how you are perceiving yourself and how others may perceive you, not that you should care about that, but, like just how you interface with the world, then maybe it's worth doing. And so I'm not saying you have to do everything that we offer or everything that's out there, but find something that makes sense to you.
Right.
And I cannot agree with you more. If it is something you are interested in and want to find out more about, you are going to have a hell of a lot more options.
Yeah.
And the whole kit and caboodle basically will be open to you, as opposed to really being narrowed down. When the follicle is lost, when the follicle age is out, we don't get a new one.
Right.
That's the thing that's really heartbreaking about these patients. And they say, well, what about, some of these, what about PRP? And I say, I can pump all the PRP in the world there, but unfortunately, if you don't have a follicle, we're not doing anything. We're not doing anything beneficial. So I think that come see us. We don't bite. It is a whole new world. It is more than just kind of the things that you're seeing. I think the most important thing is we can tailor it to kind of what makes sense for you.
Exactly. Couldn't agree more.
Yeah.